So today we're going to talk about the liver. The liver is the second largest organ in your body. It's located under the rib cage on the right side and weighs about 3 pounds. It's shaped like a football and is flat on one side. The liver performs many jobs in your body. It processes virtually everything that you eat, drink, breathe in, and rub on your skin. It processes what you eat and drink into energy and nutrients that your body can use. The food starts in the mouth and is chewed up. It then goes to the stomach, where the acid and enzymes continue to break the food apart. It then travels to the small intestines, where proteins, fats, and sugars are absorbed into the bloodstream. The liver then filters those fats, proteins, and sugars, converting them into building blocks. It's an essential organ that your body cannot live without. It regulates your supply of body fuel, producing and storing energy or glucose. It keeps your mind alert, your body active, and it stores and produces and exports fat. It manufactures many of your essential body proteins and is involved in transporting substances in your blood and helping to resist infections. It regulates hormones. It regulates cholesterol. It produces bile and eliminates toxins from the body. It helps digest the nutrients, vitamins, and minerals, and it helps with blood clotting. Eating a healthy diet makes it easier for the liver to do its many jobs. An unhealthy diet makes the liver work very hard and can cause more damage. One of the handouts you will receive today talks about what you eat affects your liver. Everything you eat, drink, and breathe passes through your liver. It is the body's filter. The liver changes it into energy and cleanses the blood. You can lower your chance of liver disease by eating a healthy diet. A healthy, balanced diet protects the liver from working too hard. Since your liver processes what you eat and drink to provide the body with nutrients, it is important to eat a healthy diet to help the liver run smoothly. Cirrhosis is a hardening of the liver. It's permanent and cannot be reversed. Some people can live well with it for many years. Some people get sick very quickly. The best way to preserve the liver and prevent complications is to treat the cause of cirrhosis. If your cirrhosis is caused by drinking too much alcohol, then you need to stop drinking. Staying away from alcohol is recommended for all types of liver disease. If the cause of your cirrhosis is fatty liver, you should follow a healthy diet, exercise regularly, and try to lose some weight to prevent worsening of the disease. If it's caused by a chronic virus like Hep C or B, then the medication regimen needs to be followed to help prevent injury. With cirrhosis can come a loss of appetite, nausea, vomiting, weight loss, weakness, yellow discoloration, itching, bleeding and bruising easily, fluid buildup, and confusion. Today we're going to talk mainly about the fluid buildup. When fluid builds up, a person will need paracentesis. Ascites is the fluid buildup within the abdomen. Sometimes there is also a swelling in the feet and legs. Severe ascites may be painful and keep you from moving around, eat comfortably. Cirrhosis causes pressure to increase in the liver veins, which causes the fluid to leak into the abdomen. The belly fills up with water like a water balloon. Some signs of ascites are weight gain, swollen belly, a sense of fullness, a sense of heaviness, bloating, nausea, indigestion, shortness of breath, belly pressure, hernias around the belly button or the groin, abdominal discomfort, feeling full faster, eating less because there's less room for food in the belly. That's when a paracentesis would be performed. A person should try to eat a balanced diet. A balanced diet consists of eating the proper nutrients that your body needs, eating 5 servings of fruit and vegetables a day, eating lots of fiber. A balanced meal includes 1 item from each food group, such as dairy, vegetable, fruit, grain, and meats or beans. You should try to drink 6 to 8 ounces of water a day. Drinking plenty of water will help you hydrate and allow your liver to function better. Limit your fatty foods. Limit eating foods that have a lot of sugar or salt into them. Certain foods should be avoided for a patient with ascites. You should choose foods with less sodium and prepare foods with little to no salt. Sodium intake should be less than 2,000 milligrams per day. Avoid sugary drinks, such as soda and energy drinks. Limit fried food and fast food. Too much fatty food can cause non-alcoholic liver disease. Limit your alcohol consumption. Alcohol can damage and destroy liver cells. Liver damage can lead to the buildup of fat in your liver, inflammation and swelling, and the scarring of your liver. You should eat small, regular meals. Don't skip meals and don't overeat. You should regularly choose whole foods such as fruit and vegetables, fresh proteins such as meat and dairy, legumes, lean meats, canola, wild rice, nuts, avocado, fatty fish are all healthy things to eat. You should increase your intake of fresh fruits and vegetables, especially brightly colored ones such as oranges, yellows, reds, and greens. Fruits that are high in antioxidants are vital for your overall liver health. Maximize the consumption of vegetables with a high sulfur content, like broccoli, Brussels sprouts, cabbage, cauliflower, garlic, and onions. Wash the fruit and vegetables right before you eat them to help remove the pesticides. And when cooking, try to steam or bake the vegetables so that it retains more nutrients. Choose whole grain products over white, bleached, or refined products. A person with an Ascites diet should follow a low sodium diet, no more than 2,000 milligrams of sodium per day. That is a little less than a teaspoon of salt. We should be checking the food labels for the sodium content. Try to avoid salty foods, pickles, canned or prepared food. Takeout food and fast food all has lots of sodium in it and should be avoided. You should talk with your provider about whether you should use a salt substitute or not. Avoid salt substitutes that contain potassium because sometimes the medications that your doctor is giving you will already contain potassium and we don't want your levels to rise too high. Eating foods low in salt is the key if you have ascites because the salt causes you to retain water and build up extra fluid in your body. Eating a low salt diet is encouraged even if you do not have ascites to prevent you from developing these complications. Limit it to under 2,000 milligrams a day, which is about 1 teaspoon. Salt hides in a lot of things we eat. For example, soup, chips, bottled sauces, ketchup, pickles, canned fruit, frozen meats, tomato juice, cheese, deli meats. You need to be reading those labels and checking the sodium content before you buy something. Try replacing salt with other things such as Mrs. Dash or other salt-free spices. And do be aware that sea salt has just as much salt as regular salt. It's important to understand that having low salt sodium level in your blood does not mean that you should eat more salt. It means that you have too much water in the body. Now we're going to talk about some foods to eat. You should be eating fresh foods such as oranges, bananas, apples, potatoes. Anything fresh, not already prepared or packaged, is healthy for you. Meats, you should stay on the outside and look for fresh meat, chicken, fresh pork. Stay away from canned meat, as if you look, it has high sodium contents in canned meat to help preserve it, and that should be avoided. Be careful when you buy drinks. Water is one of the best things as it has no salt in it. But if you're buying another type of drink, be sure to look at the label and check the sodium content, and remember that we're trying to stay under 2,000 milligrams a day. Instead of the salt shaker, you can use things like Mrs. Dash, which has no salt, or other varieties. Talk with your healthcare provider about that. Raisins is a good snack, as it has no sodium in it. Here's a food shopping guide that will be passed out, and it gives you some ideas of some foods that are healthy for you to eat. You need to limit your alcohol consumption so your liver doesn't have to work overtime. You do not need to limit your fluid intake unless told to by your doctor. So some meal ideas that we can have are things like baked chicken, maybe with green beans or fresh potatoes. Or you could fry up some salmon with some salad, broccoli, or Brussels sprouts. Choose whole grain bread over white or refined. I have some cards here with some menu ideas that you can take home with you today. And I just want you to be able to think about some ways that you can talk with a patient with ascites of how they can eat healthier and some snacks, some meal ideas that they can have. Thank you.